We will continue the topic of, silence please, topic of examination of the newborn. We have discussed the examination of newborn at birth, and today we will discuss the second occasion when the newborn is examined by the doctor on duty. That is called first day examination of newborn. So first is the vital sign that you need to check. Heart rate, it should be between 120 to 160, respiratory rate 40 to 60, and there should be no labored respiration. This means that the child should be taking the respiration without any working of accessory muscles of respiration. There should be no indrawing of the intercostal spaces, etc. Temperature should be 36.5 to 37.5. It is degrees Celsius in Celsius. Blood pressure of the newborn is 60/40, and CRT, capillary refill time, is less than 2 seconds. This remains the same as is for the examination at birth, these vitals. Then you must look for the urine output. The child should pass urine within 24 hours. If the child doesn't pass urine within 24 hours, you should examine the child well for any urinary abnormality. Afterwards, once the child passes urine, then later on the child wets 5-6 diapers. 5-6 बार उसका जो डायपर है, मदर कहती है कि जी मैं उसका चेंज करती हूँ. This means the urine is, the child is passing urine normally. Otherwise, you can note down 1 ml per kg should be the urine output in the child, 1 kg per hour. If the child is 3 kg, then 3 ml multiplied by 24. 1 ml per kg per hour. This is the approximate urine output in the newborn. Then meconium. Meconium should also be passed within 24 to 48 hours. The first meconium, if anyone has seen, you must be having a small child in your home. That is black or dark green and tarry, very sticky. If it sticks to the diaper or clothes, it is very difficult to remove it. Then after this, then there is a phase of transition stools. After this stays for 3-4 days, and after 3-4 days, then the normal yellow colored stool is passed by the newborn. If the child doesn't pass stool in the 24 to 48 hours, then what will you do? You must look for the anal opening. Though you have examined it previously also, but you must search for any abnormality, the reason behind not passing the stool. The feeding. By the first day, the child must have established a breastfeeding. He should be sucking well on the mother's breast. Then blood sugar. You can do the blood sugar also to know whether the child is maintaining its sugar and not going into hypoglycemia. Right? Now the second part of examination is assessment of gestational age. G is gestational age. How will you assess? First is by the calculation from the date of last menstrual period that we have already discussed. You will add 9 months and 7 days and find out the gestational age. Then if the mother is not remembering the dates, then another method is by physical examination of the child. That will also tell you the gestational age of the child. Neurological examination is also required to assess the gestational age. Third is the Ballard score. This is also specific to assess the gestational age. The third part that needs to be examined is the neonatal reflexes. What are these neonatal reflexes? These are primitive responses of the newborn child, and these are brain stem mediated. What does this mean? That the higher cortical functions in the newborn, they have not yet started developing, and these primitive reflexes, they appear and they need to be tested to know the proper functioning, CNS functioning of the child. So initially it is a brain stem response, and by the time the higher brain takes control, then these primitive neonatal reflexes, they start disappearing. So what you have to assess, whether these reflexes, they are normally present. You can note down whether they are normally present, whether they are symmetrical. Symmetrical means on both sides they are the same. Whether they are delayed or they have not properly appeared, or the response is partial. So this we will be discussing. There is a separate lecture on neonatal reflexes, then we will be discussing these in detail. The fourth part that you need to examine is the skin of the child. What happened during the birth of the child? The skin of the newborn shows many type of these lesions, which are usually physiological. Physiological means they appear and with the passage of time they disappear. Otherwise, if the mother is worried and doesn't know, and she takes the child to some unqualified person, RMP type, then he may give the medication to the child unnecessarily. Sometimes the corticosteroid ointments they are started, which are the detrimental to the health of the newborn child. So it is very important that you know what are the normal responses. First is the toxic erythema, also known as, you can note down the spelling, urticaria neonatorum. What is this? These are erythematous macules, usually 1 to 3 mm, 1 to 3 mm के होते हैं. मैक्यूल्स भी हो सकते हैं. इनका कलर वाइट और येलो on the body. They appear, they are benign. Benign means they don't have any relation with any disease. That is called benign. And self-limiting. Self-limiting means they disappear at their own. Appear in 3-4 days. बच्चे के जन्म के 3-4 दिन के बाद ऐसे ऐसे निशान आ जाते हैं, जो कि मदर समटाइम्स गेट्स वरीड कि ये बच्चे को क्या हो गया, ऐसे निशान क्यों आ गए. बट दे डिसअपीयर इन से 12 to 14 2 वीक्स तक डिसअपीयर हो जाते हैं. राइट. सो समटाइम्स दे मे बी पस्ट्यूल्स आल्सो. पस्ट्यूल मीन जिसमें फ्लूइड हो, पस्ट्यूल हो, बट द फ्लूइड इन द पस्ट्यूल, जिसमें फ्लूइड है वो स्टेराइल होता है, राइट। सेकंड इज इम्पेटाइगो नियोनेटोरम, यू नोट डाउन इम्पेटाइगो नियोनेटोरम। ये भी क्या है, वेसिकल्स हो सकते हैं, पेपुलर और बुलस। वेसिकल ये है कि आपने भी देखा होगा बॉडी के ऊपर कुछ हुआ जिसमें आपको लगता है कि पानी भरा हुआ है, दैट इज़ कॉल्ड वेसिकल। अब वेसिकल थोड़ा बड़ा हो गया तो जिसमें पानी भरा हुआ है वी विल कॉल इट एज बुलस। पेप्यूल इज ए जैसे गंभौड़ी सी टाइप हो गया जिसमें ऊपर को उठी हुई है लेकिन उसमें पानी नहीं, वो सख्त है, कई बार आपको भी दिल करता है खरोंचने को, पेप्यूल हो गया। सो दीज टाइप ऑफ लीजन कैन आल्सो अकर ऑन द न्यू बॉर्न्स बॉडी, स्पेशली वेयर दे आर अपोजिंग सर्फेस। अपोजिंग सर्फेस मीन जैसे ये सर्फेस है इसके साथ अपोज कर रहा है, राइट। ये है बच्चा, इसको फ्लेक्स करके रखता है तो ये सरफेस इसके साथ अपोज कर रहा है, यहाँ पे टू सरफेस दे आर कमिंग इन कंटैक्ट, सो दे आर मॉइस्ट बट द फ्लूइड इन देम इज अगेन स्टेराइल, they also disappear by themselves, but if the fluid in these becomes infected then you need to give the treatment, that is also to be kept in mind. Third is the Mongolian spots. Mongolian spots क्या है, बच्चे के बटक के ऊपर पीछे लंबोसैक्रल एरिया में बड़े बड़े ऐसे जैसे ब्लैकिश, ब्लू ब्लैकिश या डार्क एरियाज बड़े बड़े हो जाते हैं। सो दीज आर ऑन द लंबोसैक्रल और बटक एरिया एंड दे डिसअपियर इन फ्यू मंथ्स, दे आर नॉट टू बी वरीड ओवर। काले काले बड़े बड़े निशान पड़ जाते हैं गोल गोल से, और छोटे छोटे नहीं, दे आर 4-5 सेंटीमीटर के एरिया के करीब होते हैं। देन पोर्ट वाइन स्टेन, पोर्ट वाइन स्टेन इज नीवस फ्लेमियस, FLAMMEUS। What is this? These are deep red or purple red macules। कहाँ पे होते हैं, फेस, नेक, extremities। Initially they are light pink and then they become purple. They are also usually benign, but the point in this is that they may be associated with enlargement of the underlying soft tissue, or if on the extremities there may be hypertrophy of the underlying bone. So if these lesions are present, you need to examine the child fully, right? So these are very important points. Then mother comes to you, if you are aware of these physiological skin lesions, then you can assure the mother कि नहीं जी आप चिंता ना करो, they will disappear. Otherwise you will unnecessarily give the treatment. So if you want to ask, you can ask. Thank you.